Hello everybody, I am Dr. Miglani, MD Medicine. I am here to revise you whole medicine, surgery, pharma part on one way, and I want you should go through all the basic questions one by one. You not grab this question. Actually, I just want to give you idea what are the basic questions which can be asked in coming exams, so that you learn the basic idea to learn the topics, then make a notes and go through it. So briefly, we are going through all the questions one by one, and in the end, I will give you the key question. Answer key. First question is: which of the following cyst is having positive fluctuation test and with positive trans illumination test? In our MBBS training, we were taught about the cyst and we learned all about cyst, and there are many methods to differentiate between these cysts. The question I have picked up from that way. First is lipoma, second is cystic hygroma, third is sebaceous cyst, and fourth is dermoid cyst. Now you have to keep in mind all the basic points about all the cysts, then only you can answer. Next question is: which is the most effective drug in CAD? CAD means coronary artery disease, MI, heart attack. You can give me the answer. First is aspirin, second is sorbitol, third is beta blocker, and fourth is diuretics. I mean to ask which is the most effective and first drug which we should give to treating the CAD. Next question from COVID-19. What is the best time to start steroids? In the COVID-19, you have to learn all the things. What is CT value? What is the best time to start antiviral drugs? What is the best time to start steroids? What are the other virus belong to corona family? Why it's called COVID-19? There are many questions which can become in the coming exams. Putting this question to this slide is only was that we can learn when to give steroids, when to give antivirals, and what is the post-COVID phase. These all things you have to briefly summarize. The options are on the very first day, second is after 3 days, third is after 7 days, and last is should not be used. Now in COVID-19, there is an important question about the interleukins, which interleukin is raised, which pathway, through which pathway fever is coming in COVID-19. There are many questions which can be raised in COVID-19 session. Next question is, all are the effective way to prevent COVID-19 except. There are two questions. One is to prevention, second to cure. So these are the all are the effective way to prevent COVID-19 except. First is hand sanitization, second is masking, wearing mask, second, third is social distancing, fourth is antiviral drugs. Now again from surgery part, all of the swellings are mostly painless except. First is thyroglossal cyst, second is ranula, third is cystic hygroma, fourth is sebaceous cyst. Now many questions in many way can come, like what are the important sites of this cyst, what test is positive in this cyst, how to differentiate, how to treat, many questions. But this is the one question so that you can have idea what are the cysts. Now question from pharma part, pharma come medicine. What is the muscle relaxant of choice in asthma? First is doxycycline, second is atraquarium, third is vicronium, fourth is rocronium. In asthma, patient came to emergency with difficulty breathing and we intubate and put on ventilator and we need to sometime relax. Then what is the muscle relaxant of choice we should give in asthma? Now again from muscle relaxant, all are true about succinylcholine except it's a drug of choice in young children for muscle relaxant. It is the fastest and shortest acting. Third is it's a muscle relaxant with ganglionic stimulation. Fourth is all of the above. Now you have to learn about succinylcholine. What are the points in favor of succinylcholine? Then you can only answer. Otherwise, not. From pharmacum psychiatry, all are the atypical antipsychotic agents except flupentixol, risperidone, gypsazidone, and quetiapine. Again, from psychiatric medicine, all of the following are antidepressant agents except paroxetine, trazodone, tianeptine, and loxapine. Antipsychotic and antidepressant, you have to mug up all the side effects, what are the proper indications, what are in which condition the drugs used, what are the EPS known to occur with some antipsychotic drugs, all about the drugs. Then from the pharmacum cardiac part, class 2 antiarrhythmic drugs are all except propranolol, amiodarone, esmolol, and none. Now there are many drugs, four classes of antiarrhythmic drugs you need to know. And class 1, class 1A, class B, class 2, class 3, class 4. All drugs with proper class, what is the mechanism of action, how they act, when they should be used, when should not be used, what are the important points about each drugs we should know. Which of the following drug belong to different class of drug? Now again the tricky questions. You have to know the how it, what is the mechanism of action of these drugs. First is nicorandil, second is ibutylite, third is minoxidil, fourth is diazepam. So these are the drugs. Three belong to one class, other belong to different class. You have to answer in that way. Which of the following is different mode of action? Ticlopidine, prasugrel, abciximab, ticagrelor. Three belong to one class, other belong to different class. All are antiplatelet drugs and all are given in CAD, coronary artery disease, and one belong to different class that we have to choose it. Which prokinetic drug is known to cause extra pyramidal effects? Now you should have idea what are the drugs which belong to this prokinetic category. First is metoclopramide, second is cisapride, third is mosapride, fourth one is tagacerid. Metoclopramide we usually use, cisapride we usually use, mosa and taga is rarely used. Drug causing weight loss except metformin, topiramate, amitriptyline, glimepiride. The catch point belong to mechanism of action of the dead drugs. You can simply answer by simply knowing how it acts. Which of the following drugs follow zero order reaction? All except. And now you need to know what is the zero order reactions, what is the first order reaction, what is the pseudo zero order reactions. Then only you can answer, otherwise not. And then options are aspirin, warfarin, phenytoin, and desomerol. Again from basic pharma, what is the drugs which follow narrow therapeutic drugs? All are except dioxin, lithium, theophylline, and glyburide. You know the narrow therapeutic window for three or four drugs are there, which we have to remember. We need to remember what are the pro drugs, how they act. We have to remember what are drugs which are lipid soluble, what are drugs which follow, what are the enzyme inducer, what are the enzyme inhibitor, which are the drugs which concentrate in bile, what are the drugs which should not be given in renal failure, drugs in containing in liver failure. There are many questions which can be asked. Now, treatment of propranolol overdose are except glucagon with calcium, isoprene, atropine, or esmolol. Now you need to know when to give propranolol, how it can overload it, how it can be overdose. Now pharmaca medicine treatment of type 2 brittle asthma. Now need to know what is type 1 asthma, type 1 brittle asthma, type 2 brittle asthma, what is asthma with pregnancy, aspirin induced asthma, exercise induced asthma, asthma comes COPD, many question, many variety of question from medicine. But prednisolone, omalizumab, theophylline, and ephedrine. Asthma with pregnancy, what is the steroid of choice? Budesonide, prednisolone, prednisone, and difluzacort. In the pregnancy, sometimes patients are having profuse wheezing, and we have to give it. Then, what is the drug of choice? We should give it. This is from an art one slightly tough question. What are the branches of externally like artery? All are except extrapyramidal artery, circumflex artery, profunda femoris artery, and obturator artery. Simple question. HLA B27 positivity found in all except rheumatoid arthritis, rheumatoid arthritis, psoriatic arthritis, and ankylosing spondylitis. This question can be attempted very nicely and very easily. Now, slightly trick. You can say cramming question. Rapid white descent is found in coronary artery disease, cardiac tamponade, constrictive pericarditis, and DCMP. So there's a common mnemonics which we were using pay tax. Now you can answer very easily. Which of the following is true? Anesthesia point of view, this question is asked. Isoflurane is contraindicated in CAD. Desflurane should not be given in renal failure. Enflurane is safe in seizure disorder, and all of the following is true. Now this is set of 23 questions which I have prepared. In next, I'm giving you more tricky question, more basic question. And if you go through this question, you must be knowing that these questions are from basic ideas. These questions are not from any book, which I have personally prepared for you guys. Thanks a lot for patient sharing. Thanks.